Wait times in hospitals have never been worse. There are over 2.5 million people in Ontario who don't have a family doctor, and the system has been on the brink of collapse for years. So what is the Ontario government doing about this? Well, it turns out they're funding thousands of illegal immigrants to come into this country and have babies on our dime. Let's dig in.
But what do you expect when you bring in over 2 million people? And I'm all pro-immigration, but in saying that, we got to slow down now.
Ontario Premier Doug Ford is a hypocrite. He says immigration needs to slow down, but his government is funding a pathway for immigrants to obtain permanent residency by using a birth tourism loophole. Birth tourism in Canada isn't some fringe issue. It's a booming underground industry hiding in plain sight. For years, wealthy foreigners flew into Canada, paid out of pocket, had their baby here, and then walked away with something incredibly valuable. A Canadian passport for their child, instant access to one of the most powerful citizenships on earth, healthcare, education, social programs, global mobility, and lifelong rights, all without ever contributing a dollar in taxes before arriving. But now, things are even worse. Illegal immigrants and fake tourists are coming here to take advantage of our system while Ontarians pay for it all through a government program for free midwifery care.
Minister, I have another question about the IFHP, and it's really important for the Canadians following along at home to understand. So this program, the $900 million program, includes pharmaceuticals and vision care and mental health counseling and assistive devices and physiotherapy and occupational speech therapy and all sorts of things that seniors in Kitchener do not get unless they have supplemental health coverage. I asked you, if somebody's refugee claim is denied, do they continue to get all of this coverage? And you said no. Here I have your website. It says, as a refugee claimant, you'll get IFHP coverage if your claim for refugee protection has been rejected by the IRB. So did you lie to the committee, or is your website lying?
Illegal migrants and non-residents, including people fully capable of paying on their own, are accessing publicly funded maternity care at taxpayer expense while hospitals and provincial services absorb the costs. And most Canadians have no idea how widespread this has become. Right here in Ontario, the numbers have absolutely surged since the pandemic. Thousands of non-resident births were recorded in 2024 and 2025 alone, placing Ontario at the center of a nationwide rebound, with Quebec and British Columbia close behind. I would say that Canada's citizenship by birth policy has effectively created a loophole that the entire world knows about, and ordinary taxpayers like you and me, we're footing the bill. The question is no longer whether birth tourism exists. The real question is, why has Canada allowed it to grow for this long? And who's actually paying for all of it?
So what you're seeing here is the potential for a massive abuse of Canada's immigration system, the humanitarian and compassionate system. And also, frankly, the Liberals did not account for this type of population growth in their levels plan. When somebody is invited to Canada on a temporary resident permit, they are a temporary resident. They're not here to stay permanently.
Right.
But the Liberals have, in bringing in so many people so fast, and then not thinking about what the downstream effects would be on healthcare, housing, and jobs, it's not fair to anybody.
Well, as I mentioned, it turns out it's you and me. Through programs like Unison Health and Ontario Midwifery Services funded by the Ministry of Health, uninsured, or what is being referred to as undocumented individuals, i.e. illegal immigrants, can access midwifery care, labs, consultations with providers reimbursed at rates that mirror Ontario's publicly funded healthcare system called OHIP. I have filed for access to information to find out more about this elusive program, including costs, number of people served, and who exactly is getting what. If you want to support this work and help offset the costs of filing for these documents, please do so at rebelinvestigates.com. That's rebelinvestigates.com. An insider told me off the record that taxpayers are increasingly covering these costs through 4 main channels, all with little oversight and almost no expectation of repayment. First and foremost, there is the standard OHIP billing, where hospitals and physicians bill the province directly using a valid health card. Second is the interim federal health program for refugee claimants, which covers medical care, including prenatal services, hospital births, and physician fees, all federally reimbursed. Third is the traditional birth tourism model, wealthy foreigners paying cash out of pocket. But the fourth pathway is the one insiders say is quietly exploding. Through provincially funded uninsured care programs, including midwifery and community clinic services, these so-called undocumented or uninsured illegals can still access prenatal care, specialist referrals, lab work, hospital deliveries, and other taxpayer-funded services, even when some are fully capable of paying themselves. And according to this insider, the system is being openly exploited because almost nobody is asking any questions. The only requirement is a loosely defined claim of residency, not immigration status, citizenship, or legal presence in Canada, but simply having a primary place of residence and some connection to the area. The Conservatives have been calling out the fraud, exploitation, and abuse of publicly funded migrant healthcare programs like the Interim Federal Health Program as proof that when loopholes exist, they get used. Why would this be any different?
The minister just said that the Liberals' immigration plan is, quote, working. The Liberals are spending at least $800 million this year because they allowed the asylum backlog to mushroom to nearly 300,000 people. And these are people, many of whom have bogus claims, and they allow them to stay in the country for years and years. That's why they had to increase that program to that level. This strains healthcare, it strains housing, and it makes a mockery of our once compassionate asylum system. Is this really what the minister defines as an immigration system that's working? And what I've in front of you today, colleagues, is to restrict birthright citizenship to permanent residents, at least one person being a permanent resident, one parent being a permanent resident or a citizen. This would align Canada within other peer nations and would somehow, I don't support Bill C-3, but it could restore the value of Canadian citizenship that has been eroded over the last 10 years.
But misuse is hard to track because the Ontario program doesn't appear to have its own budget line item. It's instead housed within Ontario's broader midwifery services funding, which totaled almost $209 million in 2025-2026, with uninsured client reimbursements administered through transfer payment agencies operating under the Ministry of Health. In 2025, the AOM, the Association of Ontario Midwives, even advocated for removing barriers to the program by expanding and entrenching it. They note that it was based on an average cost of $1,953 per client and call for it to be updated to reflect changes in tests, procedures, increase in cost, inflation, etc., but not that there was any actual cap. At nearly $2,000 per client, and recent data showing there were roughly 2,775 non-resident births in Ontario, this could be in the millions of dollars at taxpayer expense, depending on how many of those paid for their own way or relied on you to do it for them. I reached out to both the Ontario Ministry of Health, Media Relations, and the Ontario Association of Midwives to inquire about how many people are using this program, its total cost, eligibility criteria, oversight and reporting mechanisms, who's accessing it, how funding is monitored, and what safeguards, if any, exist to prevent misuse or exploitation. It's been crickets so far. Look, compassion is one thing, but this has crossed into full-blown citizenship shopping funded by the Canadian taxpayer. At a time when Ontarians can't find family doctors, ERs are overflowing, children are dying, waiting to be seen in hospitals, and the system is still making room for non-residents to access publicly funded services and secure Canadian citizenship for their children. Across Canada, people young and old are being offered medically assisted death instead of getting the care and support they actually need.
I am 84 years old, and a year ago, an amazing thing happened. When I got out of bed one morning, I was suddenly in excruciating pain, so much so that my daughter came running in from another room. She called an ambulance. Off I went to the Vancouver General Hospital, and I was approached by a young lady doctor whose very first words out of her mouth is, "We would like to offer you MAID." I was taken aback. That was the last thing on my mind. I just wanted to find out why I was in pain. I did not want to die.
They're told to keep paying, keep waiting, and keep sacrificing, while the system they fund slips further out of reach. For Rebel News, I'm Tamara Ugolini.